you. I decided to do something different than the.
And we are recording.
Thank you, Suzanne. We are excited to join you tonight. We do want this to be interactive, and our biggest goal is to walk through the agenda, but from the perspective of telling you stories and telling you examples we've seen in our careers. I'm excited to be able to kick off some questions to Dr. Ballard, and our plan is to walk through introducing ourselves from the perspective of maybe some pivots or turns or twists that our careers have taken, and then to speak broadly across healthcare to drive a little more directly into skill sets that are helpful to achieve or to move into these leadership roles and to prepare for them. And then how do you navigate that? How do you go towards a certain position you're interested in? And the last part is we want one of you all to give us an example of a position that would be a kind of goal position one day. And as a whole group, all of us, we're going to talk about how do you get there. We have an example one behind the scenes if we need to, but we'd love for one of you guys to bring one of those examples forward. So to get started, Dr. Ballard, as you and I both know, healthcare offers remarkably wide continuum of opportunities, everything from operations to innovation to finance, policy, clinical leadership. And curious to kick us off in terms of a few experiences from your career as part of the introductions, in terms of either for you or for those that you've mentored that kind of illustrate how diverse and dynamic career paths in healthcare can be.
Sure. And so, Megan, and it may just be my screen. I don't see my image on the screen. I see you. But if you see my image, then we're good. Yeah.
Here we go.
Yeah. Great. Well, it's great to be with this group. I was sharing with Suzanne that I think I'm a very old person because turns out that in 1978, I tutored the uncle of one of the participants in economics. He really didn't need very much help, but anyway, so some initial perspectives here on different experiences. So today you have a whole lot of people who go into healthcare who engage a whole lot of different fields. I would say 40, 50 years ago, people pretty much sort of followed a kind of a certain pathway. You had, my experience, if you were a non-clinical administrator, most everyone did an MHA. If you were a physician, you're basically a physician, and even if you ended up being in a physician executive leadership role, pretty much you were just your background was you went to medical school and you did some clinical work. So today is very different. I'd say, and I'd just be brief about this, but I understood as an undergraduate that I was interested in the big picture of healthcare. This led me to study economics as an undergraduate. And then I also understood that I was interested in how you allocate scarce resources in populations, and that led me to do a master's in public health and a PhD in epidemiology when I was in medical school. Now, my classmates sort of shook their head and said, "David, what are you doing walking across the street to the School of Public Health? What does that have to do with being a physician?" I was one out of 160 people who did that. I think today probably 60 or 70 out of maybe 180 medical students do work in the School of Public Health, and many students do, as some of you are doing, MD, MBAs and other. I think literally we had maybe one lawyer in our class. I don't think we had anyone with an MBA, and I was the only person doing anything in the School of Public Health. So in my case, I had this kind of broad background. My challenge was to sort of figure out where was clinical care going to fit in what I was doing, and I had this particular sort of epiphany driving back from Tarboro, North Carolina one day with my mentor, Ed Wagner. And I know some of you may have heard this in our last session. I'll just be brief. Ed said, look, David, there's 16 general internists in our group here at UNC. One person is someone's doctor, Jim Bryan. The other 15 of us, we basically wave hands over patients. So, David, you really need to think about the role of clinical care in your career. Go get some clinical training, get some perspectives. But at some point, you're probably going to have to decide if you want to do the things that you're doing, that you think you want to do, lead large healthcare systems, shape thought in healthcare nationally, globally, you're probably not really going to be anyone's doctor as a primary care physician. So that was sort of an aha for me early in my career. So, some other thoughts. So, depicted here, we sort of hospitals, healthcare systems, physician group practices, post-acute care, startups, other opportunities. And, I think, one idea, if you're a physician, is that, if you're going to be a leader in a group practice, for the most part, you're going to need to have a significant background in clinical care to ultimately become the leader of a medical group. There are some cases where there's a national search to bring in a medical group leader, where there's a real interest in having a physician who's mainly a business person. But for the most part, these medical groups have physicians who are cultivated within the group first, and then become leaders. So those are some initial perspectives. One other thought about nursing is that I think in 2025, I know we have a couple of nurses on Zoom today. I think a doctoral degree is pretty much essential if you want a career as a nurse executive. Although, I think there's many. I know a nurse who's a PhD in sociology, another nurse who's a PhD in informatics, another nurse who's a PhD in psychology. So I think the pathways to leadership roles are very diverse. But maybe I'll just have one kind of final comment. Megan, you might have some additional comments. One of my mentors, Carr White, and if you folks have not read Carr's New England Journal of Medicine paper in 1961, The Ecology of Medical Care, you need to read it. It was his ideas were way ahead of his time, framing up sort of the role of primary care and accountable care organizations, for example. But Carr told me, he mentored me in the 90s. We probably had a phone conversation every day. And he said, David, one of the things you need to understand is that a lot of people in healthcare leadership don't have the kind of academic background that you have, and you really need to focus on your ability to provide intellectual leadership, write about what you do. And so I would just encourage you. You're at a great university, University of North Carolina. I would engage opportunities to write, to publish. I haven't worked in academia since 1999, and my H-index is 60. So I think intellectual leadership is just really critical to differentiate yourself in the leadership space. But Megan, some other comments?
Yeah, it's interesting as you think. Let me flip back a slide. By the way, this was supposed to be hospice, not hospital. I apologize for that. But as you think about all of the different healthcare leadership opportunities, I think the one constant is that healthcare leadership careers are not linear. And Dr. Ballard, you spoke to that a little bit. The other thing that's constant across all of the different opportunities is that we all as leaders are trying to identify problems and find solutions in these different situations. And so I love hearing your stories about how different people have impacted your career, and how, you will, and to you all as an audience, you will have people say things either you agree with or disagree with that are pivotal moments in your career. One example that my career, I had a family friend who I babysat for, who was a VP of legal at a health system. And she would have me come in and pay me babysitting rates to help her get her office back in order during like that week between Christmas and New Year's. And I'll never forget the year that HIPAA, this is aging myself, but the year that HIPAA was coming along. And she said, I need you to go print everything you can find about HIPAA, make me notebooks so I can be prepared. And then can you start to draft it? And I go, Elizabeth, I don't know anything about HIPAA. I'm not a lawyer. And she goes, well, we all have a problem that none of us know anything about. So can you just help me get started? And she goes, you know just as much as anyone else because this is new. My point in saying that is she taught me that I didn't have to have all the answers, but I could go find them and I could bring value in ways. Now that was I mean, I was paid, but it was not a formal title. So as you all navigate your careers, pay attention to those moments that what somebody said really shapes you, whether it gives you wings or it challenges you in different ways. But ultimately, I think each of us, no matter what role we're in, we're contributing towards something to drive the margin to be able to provide the mission. And then Dr. Ballard, you started to speak towards the intellectual leadership too. And I think this slide is more important than the previous slide. The titles we all take on are not as important as why we're in them and what drives us. Dr. Ballard, what else would you add in terms of the personal impacts beyond the solving of problems?
Well, I mean, I think people are driven in healthcare to improve the health of populations. They're driven to make a difference. And I'll say that when I was the chief quality officer for Baylor Scott and White Health from Baylor Healthcare System, Scott and White Health from 99 to 2018, almost every weekend was punctuated with an opportunity to improve care somewhere across our 1,000 clinical sites. I'd get an email at midnight on a Friday night, and it was my opportunity to solve the problem, say, in one of our emergency rooms. And the only way to do that was because I actually would visit and do rounds at our hospitals. And so I knew the chief medical officer, I knew the chief nursing officer of every hospital. And at midnight on a Friday night, I had the cell phone of those people to call to say, hey, are you aware of this problem in Marble Falls, Texas, in your emergency room? These are the issues, I'd like to, help you try to solve this problem and deal with this concern the patient and the patient's families have. So, ultimately, healthcare is a high-touch business and it's a relationship business. And so, if you think about, well, I don't know if I want to be in a leadership role because, I love taking direct care of patients. I would just say in healthcare, you can, throughout your career, you can stay very closely in touch with patients while also leading a very large organization, but it requires you to do that deliberately, like very intentionally visiting, say, the various clinical care sites of the organization for which you have an executive responsibility to develop those relationships and understand the environment.
And the only thing I would add into that is if you're like myself, that you don't have a clinical background, you're more of an administrative background. It's so important for us to get into the clinical space. If there's a business plan that you haven't walked through the patient care plan, even watching patients and watching the pathway or talking to frontline staff, that can be really powerful when you pull the care path in and layer it with the finances and resources. So that's just another piece to throw in there.
Yeah, I mean, if you're a hospital CEO, regardless of whether you're a nurse or a physician or don't have any clinical care background, if you're not doing rounds in those hospitals, if you don't have a physical presence in the care delivery space, you're not going to be effective in your job.
Yeah, I agree. Well, moving on to the skill sets that are required to achieve this. So what are some of the skill sets that either you've seen or you've personally purposely developed that are essential into stepping into healthcare leadership roles today? And then how might this audience begin to build or demonstrate those skill sets in their careers?
Well, there's a lot of space to cover, but as you we were discussing, Megan, you don't have to have a direct clinical care background. That's helpful if you do, but if you don't, you just need to know you need to be able to connect with patients and families and caregivers. One thought I have in terms of executive leadership, empathetic listening is incredibly important. And that skill can be developed. So I think that's really, really important. Communication. So when I was at the Mayo Clinic, we had a great CEO, Bob Waller. Bob was an ophthalmologist. And Bob used to say, I need for the key messages to deliver to the Mayo Clinic organization, I need to find 10 different ways to do that in 10 different environments across our organization. And I was really impressed. This guy was an ophthalmologist. He was Barbara Bush's ophthalmologist, but he really focused on the importance of being an effective communicator.
I agree. I think if there's one skill that you're going to hone in on, it would be the communication, because I think that applies to, if you're a good communicator, that applies to situational leadership, that applies to even empathy. And so completely agree. I do find it interesting how these skill sets have changed over time. There's, as being an executive recruiter, there's a number of reports we look at every year and the trends, but yet the ability to build trust with people continues to be one of the top pieces. And even if you look at pre-COVID and post-COVID, and you look at 50 to 100 years ago, the one common ground is the communication. I do think how we've unpacked that with empathy and with emotional intelligence and some of those pieces, that might look a little different. But I think if there's one skill to work on, it's the communications. And I find the fastest way to get there is just always be learning. Dr. Ballard, that's something that I admire about you. I feel like you're always learning. But I do think that's one area, whether it's a podcast or a publication, just something to always be expanding your mindset in these areas.
So Megan, I think we need to get some perspectives from our colleagues on this Zoom, but I'll just underscore one other important technical skills, sort of financial acumen linked to data literacy and analytical skills. So, many of you are doing an MBA, and certainly the UNC MBA is very intense from an analytical perspective. I think in 2025, the financial performance issues are so huge for healthcare systems that you don't need to necessarily yourself be able to do return on investment analysis. You don't need to do evaluation of a company you might be inquiring, but you need to know what questions to ask, and you need to have a sense of whether the data that you're working with are data that you can trust. So I think 50 years ago, maybe you could be the CEO of a healthcare system, and it was maybe about relationship issues, and you didn't need financial acumen and sort of analytical and data literacy. But in 2025, you need to understand how to assess the performance of your organization and make sure you have teams of people who are doing that well.
Agree. And then I would layer on top of that the culture, the finance culture that comes with that, which when I hear the word culture, I think of how are we being inclusive and all these other pieces, but I think there's also an accountability culture within those skill sets you're talking about. So Suzanne, if it's okay, we can take a pause and take questions before we jump into the other part of the talk.
Absolutely. Let's go ahead. So again, raise your digital hand, unmute, and let's hear some questions.
And we welcome comments as well. So this is a place for either thoughts, comments, insights, anything.
Oh, sorry. I'm supposed to raise mine. My name is Emmanuel. I'm actually an undergraduate student at UNC. But I really liked what you said about like developing skills, especially like data literacy. And one of the questions that I have for you is what are things that I can do, especially as an undergraduate student, that can kind of like prepare me for that. Like I'm considering taking like an accounting course, just to just gain skills and understand what like an income statement is, liabilities, owner's equity, all that. But like what like other skills do you feel like as an undergraduate student I can kind of like work towards to help prepare me for that?
And so you're a major in the business school at this point?
So, I'm a health policy and management
Oh,
major,
great. Yeah.
but
Okay.
I minor in business of health.
Yeah, great.
Wonderful.
So I would, I would strongly encourage you to, have opportunities to analyze real data, but also ideally, I would seek out opportunities to collect data, uh, clean data, and work with data. My undergraduate thesis in economics, I published it in a journal that if you want tenure in economics, you'd like to publish it in that journal. And I collected data on 100 general practitioners in the British National Health Service, and I did everything. I got 98 people answered my survey. 97 of them let me look at their income records. I had the 80-column punch cards. I wrote the SPS programs. When I went to publish it, I wrote the SAS programs. So I would try to get your hands dirty with primary data collection, cleaning up of data to have a real feel for that. I would also challenge you, if you're writing an honors thesis, publish it. Go through that process. Go through the process of putting your ideas out there in the peer review world for criticism. So I think there's certainly, I'm sure there's plenty of existing data sets floating around the School of Public Health, and it's good to be able to analyze, existing data. But I would, argue that that you want to have some kind of primary data collection opportunity.
And Suzanne, thank you for adding the link to the short courses and resources. I completely agree with Dr. Ballard. I think the more you can get exposure to research while you're in the higher ed setting, it's will shape you in ways you don't even know how, in a good way. The other thing I would say is begin with the end in mind. Let's say you're wanting to at some point get your MBA or at some point get your MHA. Consider taking your required biostat course as a graduate level course. It would push you a little bit more. It would be a little harder, but if you end up going to the MHA afterwards, then it counts as that requirement because it's in the same school. And many schools accept, and this is where rely on your advisors because I don't know who accepts what across schools, but begin with the end in mind. The other piece is be very purposeful about your electives. One thing, I was in the School of Public Health for both my undergrad and grad school at Chapel Hill, but one thing I did specifically was I really wanted to learn about consumer behavior. So I took a marketing class in the school of business. And just what are those key pieces that you definitely want to get exposure to? And then the last thing is if there's, whether they be work opportunities, the Shep Center has an amazing, rich opportunities. There's many other opportunities across the business community as well. Consider those because it's a really unique community in Chapel Hill. And then there's something called is it the Shack Clinic, Dr. Ballard? Do you want to speak to that? Because that's a great exposure as well.
Sure. Many of you are familiar with Shack Clinic, Student Health Action Coalition Clinic, founded in 1966, a collaboration of the schools of nursing, pharmacy, public health, and medicine. It's a great place to learn how to work in teams, and it's a great place to provide care to people who have limited access to care. One other comment I would make is that take every opportunity you can to present your work to groups of people. Obviously there's a lot of challenges with finances these days, but present your opportunity at conferences, at national meetings, international meetings, to the extent you can put together the resources for that, because having the opportunity to communicate to large groups of people is really a great step in developing an executive presence. And so I think early on I probably wasn't particularly comfortable doing that, but I worked through that while I was at UNC, and also when I was a medicine resident at the Mayo Clinic. And I think ultimately speaking to large groups of people about healthcare issues was really an important asset that I had in my career. Yeah.
The final comment, and then we'll move on to the next section. But the final comment would be develop healthy rhythms. I don't like to talk about New Year's resolutions or about changes. I like to talk about rhythms. And I think for everybody in the audience, whether you're in undergraduate or graduate or in a position, it's never too late to establish those rhythms. I do think when you're in undergraduate work, you may have, like, looking back on it, on my life now that I have a 16 and 13-year-old and I'm working and also teaching, I think undergraduate was such a prime time to do that. You also have so many great resources to do that. You have career coaching, you have wellness resources, you even have the SRC where you can develop good, healthy physical rhythms. But figure out what are the rhythms that matter to you, because I think at any point in your career, you can assess your rhythms, and especially early on in your career, like during your training, to figure out what rhythms matter to you, and across mind, body, spiritual, everything, and really start to I guess apply those into your life.
So Meg, one other comment I'll make is that I think it's important to create your own ideas and pursue them. I remember when I was thinking about a master's thesis, I went to my advisor and I said, look, do you have something you're working on where there's some part of it I could do? He said, no, I'm not interested in handing you something. You think about what you want to do for your master's thesis and come back to talk to me about what you want to do for your master's thesis. And then let's see how I could help you connect to the resources to do that. So I think it's very easy as a student to connect to a faculty member and say, oh, yeah, I want to be helpful. And this already fully baked research agenda and just doing a paper with that fact. You want to do some of that stuff in your career, but you also want to pursue your own ideas.
For sure.
Great.
So moving on to the next section. Oh,
I
go
just
ahead,
wanted to
Susan.
add one thing. Also, I'm putting some extra resources in the chat, but I also encourage students to even dive into like maybe some business research, market research, some of those other parts that you can easily do on campus. And again, too, I have a few places over here in the chat where you can do presentations. Again, you'll see the case competition was last year's, but it just gives you a little taste of the healthcare case competition. Nursing 625I is excellent for all students that want to practice those skill sets of presentation, a little bit more of that kind of research toward solving some problems. And then we also have the STAR program for folks associated with peanut Flagler. So thank you for the plug, because I think those are other resources students can access.
Those are perfect. And one thing I forgot to say, if you've never participated as a patient in a clinical trial, see if there's one at UNC to participate in. And it's okay if you're scared of blood and don't want to participate, but there's some that are not related to scary clinical areas that just to be a part of a research study too can really open your eyes to the whole system and process. So as a reminder, we have 2 more sections, and the final section is all about you all. So this section, I really want to ask Dr. Ballard, as we said, career paths in healthcare are rarely linear. What strategies or approaches would you recommend for someone in the audience or someone looking to intentionally navigate their career toward a leadership role in healthcare? And especially given how complex and non-linear the industry can be.
Well, I think one challenge, regardless of whether you're a nurse or a physician or a pharmacist or whatever, is you think through, okay, to what extent should I go out and just get some experience versus to what extent should I have a broad-based academic background? Sure, you could say the simplistic thing is to try to do both things. I know we have several MD, MBA students on this Zoom. And I think one of the challenges is you're a physician, say you're doing a clinical training program as a resident or fellow, it's very tough to free up the time to do a rigorous MBA. And then later in your career, it's tough to do that. And so, I think that if you feel like you're interested in sort of formal executive leadership roles, whether you're a physician or a nurse, I think the idea of, getting a dual degree like MD, MBA, or getting RN, MBA, that makes a whole lot of sense. I mean, ultimately, it depends on where you want to be going with your career. If you want to be a nurse executive, you probably need to have some part of your career involved with clinical nursing. Being involved with providing care in a care setting. Maybe it's in a hospital. Maybe you're going to end up then being a unit director, and maybe you're going to be a nurse partnering with a physician to lead a clinical service line. And then ultimately, you might be the chief nursing executive for a hospital, and then the chief nursing executive for a healthcare system. But you need to think about the pathway to get there. And you need to think about when in your career do you carve out the time for this additional academic training. And most of you have already decided to do MBAs relatively early in your career, as one example.
Absolutely. From a executive recruiter's perspective, when I put that hat on, I would say a couple things. The first thing is being ready, and being ready does include the formal training and some of the technical skills. Again, once you get out of a program, or if you're out of a program, if you're not learning something on a regular basis, but I also think it's being ready, taking an assessment of yourself, really diving deep, understanding your personal brand. I'm not going to go into that this evening, but happy to talk to you about that offline, or even career coaches within the school can talk to you, can share that too. But really determining what is your personal brand, and then making sure every aspect of either online or other presence, your resume, your cover letter, they align with that personal brand. And then the other piece is understanding what's important to you. My dad used to have this theory of zone of indifference, and he said, if something's inside your zone, so draw a circle. If you put it inside your zone, that means you fight like heck for it. If it's outside, you let it go. And so applying that to being ready to go into the leadership process before you ever see a position, know what's inside your zone and what's outside your zone. One example that was talking to a physician leader the other day, he was saying, well, I can't take your opportunity because I want to be in a big city. And I go, well, what is it about a big city that's important to you? Is it the restaurants? Is it the airport? Because that's okay for that to be part of your circle. And he goes, no, it's because I want to do the big cases. And I go, well, you don't want to live in a big city. You want to work at a tertiary center that has the more complex cases. And so he started to think about his search a little differently and being willing to talk to other opportunities, but he had to dive deeper on the why. So think about what's in your circle and just keep going deeper. Why is that important? Why is that important? And understanding what's important to you. And then Dr. Ballard and I both could go through and share with you key pieces within all of this. But Dr. Ballard, what top advice would you say in terms of getting into opportunities or going through the interview process?
Well, I mean, I think you need to, first of all, figure out how to bring value in the job that you're in. Okay, you need to figure out what can you do to. We're talking about healthcare. What can you do to help the community and the patients served by your healthcare entity? And so if you're not doing that, your career is not going to go anywhere. Because if you just think you're going to progress into these incrementally larger executive roles, it's highly unlikely that that's going to happen, because the reality is that People know how to ask questions. People interview people. I've been involved with recruiting people myself, in addition to now working in the executive search world. And so the starting point is you have to figure out how to provide value to your organization right now, but also how to have growth and learning opportunities while you're doing the job that you're doing today.
And then a big piece of it is telling your story of that impact. One time I was recruiting a family medicine chair, and there was a female leader out of Chicago that led 10 different clinics that I thought was just a rock star. I asked her the question about financial acumen. I didn't say it exactly like that, but she goes, "Oh, that's an area I don't know, and I need to learn more. I don't have an MBA." And so I go, "Well, let's dive into this a little more. Can you tell me about how your budget process goes?" And I go, who determines what volumes you're going to commit to? And she goes, "Oh, I lead a team and we commit to volumes." I'm like, "Okay. So who determines what resources are needed and how many providers and how many sites?" And she goes, "Oh, I lead that." And I was like, "Okay." And so then I said, "Well, month 1 into a new fiscal year, there's a variance. Who responds to that?" And she goes, "Oh, we get a team together and we look at data, and very data driven, and we determine what's driving that. And then we resolve it and have an action plan." And I go, "With all due respect, you lead budget. So can you tell me why you feel like you don't?" And she goes, "Well, I'm not in the budget system and I don't have an MBA." So the other piece I would say, in addition to Dr. Ballard's comment about adding value, is that you figure out how to tell your story, and not in a way of what you don't have, but what you do bring, and how your leadership does impact your current role.
So Megan and I are definitely interested in your perspective. So I'll add one other comment, and hopefully we'll have some questions or comments from you folks. But so one thing that I will say is that I have recommended people I mentor to look at other jobs, but I've also said, don't look at other jobs unless you possibly might take another job, because you're wasting your time, you're wasting the time of the organization. You can learn a lot by interviewing. And I'll say, so sort of admitting this, in my own situation, I had a great job in Dallas, Texas with Baylor Healthcare System, Baylor Scott and White Health. My wife had a great job in Texas, a partner with Texas Oncology, the largest cancer group in the United States, 700 partners. And so, but I was interested in thinking about what's the next thing. And so, recruiters would reach out to me and on the margin say, "Okay, let's kind of look at this job." I actually had a moment where I'm doing an interview with this very large search firm for a job. And the person who was going to interview me didn't know that we were already on camera. And she said, "This guy is never going to leave his job. We know he's looked at other jobs and he never leaves, And so it's a small world. And Megan, you may be able to comment about that, but I would just say, don't just go look at jobs because you think you want to learn something. I would only look at a job if there's some possibility that you might actually take that job.
Yeah, I would say one of my only regrets from Wake Forest, I was there for about 14 years, is not interviewing more often, because I think interviewing does keep you sharp. However, I completely agree with Dr. Ballard. You should not interview for something that you would not take. Like, I'm a North Carolina girl. I would not leave North Carolina, so there was no point in me interviewing outside of North Carolina. I was in Baltimore for a little bit, but point to Dr. Ballard's point is that interviewing helps shape what you're accomplishing in your current role and what you want, but make sure that you truly are invested in possibly the opportunity. People see through it. If you don't have a clear why statement, why are you interested in that opportunity? You see through it, and the why is a big part of the process.
So we need some comments or some questions. Yeah.
Please go ahead.
Thank you. My name is Hafiz. I am an MPH student at Giddings in the Applied Epi concentration. So from the panel discussion, what I understood is that the health professional or someone who is vying for a job in the healthcare industry needs to be jack or a Jill of all trades and dip their hands in almost every aspect of healthcare. And I noticed that Emmanuel from previously, he asked something about financial literacy or literacy on an aspect that for me was also kind of difficult because when you talk about financial literacy, you talk about billings and you talk about medical insurance and the reimbursement schemes, and that can be like really daunting. So do we really have to get into the nitty-gritty of those things in order to be, a little bit versed about financial literacy, or does a simple review of Econ 101 do it?
Well, my perspective would be it depends on what you want to be doing in a healthcare organization. But if you want to be working in a healthcare organization that has a broad range of business portfolios, maybe the organization has a accountable care organization, maybe it has an HMO, has its own insurance plan. Maybe it has joint ventures with physicians. There could be a whole lot of different types of business arrangements that an organization engages. So the extent to which you're going to work in really complex organizations, then you need to be able to think about whatever you might be working on affects different parts of the organization. How does it affect the performance of the HMO? How does it affect the performance of the hospitals? What's the impact on physicians and medical groups? Yeah, you can't know everything, but you need to be able to learn, and you need to have some kind of financial background, for some kind of financial literacy, certainly in any healthcare organization I could think of in 2025. So, but you learn by doing, and you seek opportunities. I mean, one of the things that I would do early in my career is, so I'd have statisticians who are going to work on financial analyses. I'd get the CFO to have someone in the office of the CFO to work with them on a project, so that the statistician would become more comfortable with financial literacy and being able to communicate the results of the analysis. Megan, I don't know if you have thoughts.
So I will say I'm a little biased because I teach finance in the School of Public Health. However, I think you again start with the end in mind. What do you need to do the role? I do think if you have no margin, you have no mission. And especially in 2025, if you don't have a good grasp of funds flow, that doesn't mean you have to have CFO level financial acumen. And so figuring out which courses meet that goal. The one piece you do need to have to be at the table is just the literacy from a awareness and being able to speak the language. Again, that doesn't mean audited financial statements. That means very basic, like what levers do you have to impact margin? It's revenue and expenses, and how does your role then impact that? But not to get into detail, but I would say you do need some level of financial context to be able to have an impact, but it doesn't have to be at a CFO level. And the other thing is, if you think about, this is also dating myself, this show, Who Wants to Be a Millionaire? There were 5 lifelines, and one of them was poll the audience. One of them was call a friend or call an expert. The call a friend, make friends throughout the institution. I always had a friend in budget. I always had a friend in revenue cycle. I always had a friend in coding that I could call and say, something doesn't feel right. So you got to have enough knowledge to know it doesn't feel right and to know which questions to ask.
So one comment is that Being able to communicate financially helps you to argue about the importance of something you're doing to the CFO. So for example, 20 years ago, I was trying to advance use of pneumococcal vaccination. And one opportunity was to provide pneumococcal vaccination to Medicare beneficiaries before they left the hospital. Our CFO said, David, there's all this quality stuff you want to do. It just costs us more and more money. And I said, you don't get it. Medicare is paying across our hospitals us more than $1 million a year to give pneumococcal vaccine. So, if we don't deliver those vaccines, we're leaving $1 million on the table. And so that, you may be in, I was interested in preventing deaths from pneumococcal pneumonia and hospital admissions from pneumococcal pneumonia, but to argue about the resources to help drive that, I needed to let the CFO know that, hey, guess what? Medicare pays us over $1 million a year if we actually do this for appropriate patients across our hospitals.
There's a piece to change management, and I'm going to go ahead and advance to the last slide while I say this. There's a piece to change management that's WFRM, what's in it for me. And so to be able to, so it's W, what's in it for me, whatever, think of like a radio station acronym. But if you can figure out what's in it for me for each of your stakeholders, with finance being a key stakeholder, and your people, HR being a key stakeholder, and your strategy, if you can figure that out and tell that story, that's when you're going to get things approved and make things happen. So the very last section, does anybody, it's not scary, I promise, this will be really fun. Is anybody willing to throw out a position that you're interested in at some point of your career? It could be a dream job or it could be a basic piece. It could be a position you've applied for recently, or it could be a position somebody that you look up to has.
Here you go. Is this a hospital epidemiologist? Is that a question? Yeah. Hafiz, would you like to talk about that? Are you on mute?
Yeah, sorry about that. Yeah, so the hospital epidemiology position, it appeals to me because I am a physician by training. I'm an international student, so I've got like 8 years of clinical experience under my belt. But navigating the US healthcare space, I have realized that the system here works a whole lot differently, but there are some similarities in that hospital-acquired infections are a major nuisance here in the US as well. So in terms of, I like how Gillings has the motto, local is global and global is local. And COVID-19 is the perfect epitome of that. So as a hospital epidemiologist, you'd be able to apply universal principles, not just in the US, but principles that can work elsewhere too, across the board. So that's probably a position that I'd be interested in.
Yeah. Okay. So Hafiz, so let me ask you a question. Do you have a medical license in the United States?
No, I
Okay.
don't.
And so, my wife came from Italy on a clinical J1 visa. Took her 10 years of clinical training at the Mayo Clinic to be able to work as a radiation oncologist.
Yeah.
Not everybody's going to do that, but I'll just say this, Hafiz. One of the issues for you is you're a physician, and if people are looking for you in the roles of hospital epidemiologists, they're going to think, well, maybe a non-physician, maybe a nurse or somebody who's maybe got some background in epidemiology, but think about a physician, they're going to think about, okay, to be a hospital epidemiologist in a physician role, you need board certification in internal medicine or pediatrics and infectious disease. And so, that's a long journey. Are you going to spend 6 years of your life getting those credentials? You certainly can contribute in the hospital epidemiology space, but if you're a physician and you want to lead in the hospital epidemiology world, in most environments, you're going to need to be board certified in infectious disease.
Fees, is there another role like in administration that you want to use as an example?
Sorry, can we use Senior Vice President of Operations?
Of course.
My mentor, that's kind of like, so I'm from Baltimore actually. But I was an administrative intern at MedStar Health. And so my mentor, my preceptor, he was the Senior Vice President of Operations. And I'm just curious what kind of like skills you need to have.
Great. And so Megan will have some comments, but yeah, MedStar, great organization. They're one of the 8 healthcare systems that'll be at my home in Keystone this summer for my annual healthcare roundtable. So again, I'm sorry, what degree? So you're an undergraduate health policy minor in business, right?
Yeah.
Yeah.
But
Is
I
it a
aspire.
BSPH?
Yeah, BSPH.
Okay.
Within Gillen's. I'm pretty sure it's the same major that you majored in, Megan.
It was.
Yeah.
So
And I'm considering an MH or an MBA.
Yeah. So you might do both. You might do an MBA, MHA. I would argue, 40, 50 years ago, people who went into hospital administration, almost all those people had MHAs. I think having an MBA as well it would be something that would be really helpful. And so, what you want is, you want to be able to have some internships while you're doing your degree program in hospital care settings. You want to be able to demonstrate value in hospital operations. So Megan, do you want to comment some more?
Yeah, so I think it was Hafiz who mentioned, so to be a healthcare leader, do you have to be a jack of all trades? And not in all areas of healthcare, but I would say an operations leader, you kind of do. But you also don't have to be the far extreme understanding of finance to be because you're not a CFO. So if you break it up between education and preparation, networking and finding the opportunity, and then landing the opportunity and the success in the role in this slide, from an education perspective, I do think some kind of graduate training is helpful. To Dr. Ballard's point, figuring out what's the right program, I think there's a few ways to do that. I think anyone going to any graduate program should know what they're trying to get out of it, both the program and the specific institution that or organization, university you're looking to achieve that program through. Some of that is getting, 360 people who are pitching the program or selling it, individuals who've graduated from the program, as well as hiring leaders. What do you think of this program? So to really understand, to think through what are those core questions about what types of classes, is an internship required, that really helps you to understand what you're wanting to get out of it. So once the formal, that covers the formal education, there are postgraduate fellowships or residencies in administration. I did a 2-year program at Hopkins that I chose to do because I went straight through from undergrad to grad school, and I wanted that like apprenticeship, if you will. And that was important to me. Again, you don't have to do that. You can go directly into the workforce, but I think the preparation to be any type of VP or senior VP in operations is learning it from the ground up. Really understanding the frontline patient care, no matter which role you're driving into that. I also think it's understanding the whole system, not just growing up through one area, having an appreciation for like the ancillary support areas as well as the revenue producing, just getting as many perspectives as possible. This is not a in any way linear pathway. It's not linear in terms of it could be in the same institution. It could switch across institutions. You want to stay in positions long enough to gain what you want to gain out of them, but also move quick enough to the point that you're challenged and you're always providing an impact. And then for any role, especially this one, I like that you have a mentor in this space. Pay attention, have, link in with others, network with others, ask if you can grab coffee, or really that UNC alumni network is also very strong. I don't know if you guys have read I think it's 4 Principles of Execution or something like that, where it talks about WIGs, wildly important goals, and they talk about lead and lag measures in getting to the point of becoming a senior leader. That is a lag goal. That is not a goal you can just say, I want to do this and you're going to achieve it. So from a career development perspective, consider your lead measures. Your lead measures would be, how many people am I reaching out to each month? How many people have I looked at what their profile looks like and what types of experiences do I need? What type of ongoing education? Am I joining local ACHE chapters or MGMA chapters or chapters on business health? Am I getting involved in my community through volunteering? And then ultimately, to find the opportunity, there are, and I'm keeping an eye on time because we have 2 minutes and I want y'all to be able to wrap this up too, but there are different career pages that you can set up career alerts for. You need to have a strong network and then be aware of opportunities out there. And then landing the opportunity is really knowing your why statement and doing the full due diligence to be prepared for the process.
But if you want to get into hospital healthcare system operations for an undergraduate immediately, go find a way to contribute at Shack Clinic. Figure out how to help them with improving workflow. There you'll interact with pharmacists, nurses, physicians, public health people. You'll learn about how to work in teams. That's a great opportunity. I directed Shack Clinic in 1980 as a medical student.
Yeah, so ultimately you do have to be a jack of all trades, but it's a really fun journey to get there.
Absolutely. And hopefully everybody sees that there are many different routes, but also so many opportunities, especially on the UNC campus, in which to gain the skill sets, experience the skill sets, and really dive into the healthcare ecosystem. I just want to thank our guests again. This was fantastic. Both Megan and Dr. Ballard, for just being here. I think that this is one area where I think sometimes it's a mystery. Students want to know, like, how exactly do I gain these skills that people are asking me to have, or how do I talk about them? How do I show them that I have these skills rather than, just putting it on my resume? So again, thank you so very much. I hope everybody enjoyed this evening. Again, this is our last Career Networks chat of the year. So we will see everybody again in August. You get a nice summer to kind of dive into your experiences, hopefully. But we will see you again soon. Again, thank you all to our audience, and have a great summer, and we'll see you soon.
Thank you.
Thank you.
Thank you.